Welcome dear parents, to this informative video educating you about infection prevention practices for your precious newborn both in the hospital and at home. Infection prevention measures play a critical role in safeguarding your baby's delicate immune system. These simple practices can make a significant difference in keeping your little one safe and healthy. Let's begin with infection prevention in the hospital. Firstly, we have implemented a restricted entry policy for the family members to minimize potential sources of infection. We request mothers to be there with baby as much as possible. No restriction for the entry of mother. Fathers are welcome to visit the NICU during the designated visiting hours between 3 p.m. and 5 p.m. Here are some key points to remember before entering NICU. Leave your footwear in the designated shoe rack as you enter NICU. Kindly remove all your accessories from your hand like watch, ring, sacred thread, sweater, muffler. Leave them in your respective racks and roll up the sleeves up to elbow. Wash your hands thoroughly every time before entering the NICU. Both hands to be washed up to elbow for at least 2 minutes, following all steps. Wet hands with water. Apply enough soap to cover all hand surfaces. Rub hands palm to palm. Palm over back of the hands with fingers interlaced. Palm to palm with fingers interlaced. Backs of fingers to opposing palms with fingers interlocked. Rotational rubbing of both thumb. Rotational rubbing of clasped fingertips over the palm. Rinse hands with water. Dry hands with paper towel. Discard the paper in yellow bin. Wear designated maroon-colored gown labeled with your name and NICU chapel every time you enter the unit. Also, while leaving the NICU, please return it to the designated place. For father, request nursing aids for the gown. While baby is in NICU, parental involvement in baby's care can lead to better outcomes. You must actively participate in your baby's care routines, such as feeding, diaper changes, and providing kangaroo mother care. Before handling your baby, please use the hand rub solution and do hand hygiene for 20 to 30 seconds and ensure that hands are dry. Breast milk offers numerous benefits for your baby. It contains antibodies that strengthen your baby's immune system, protecting them from infections. If direct breast feeds can be given, try to come regularly to NICU and feed the baby. Most of the babies in NICU are unable to feed directly from breast due to various medical reasons. Give the expressed breast milk to such babies. Use clean washed steel container to express breast milk. Express breast milk every 2 hours. Once you have expressed the milk, it's essential to send it to the NICU promptly. Use clean pallada to feed the baby. Try to give the pallada feeds by yourself. Don't touch the inner side of the container or pallada. Learn from the nurses about the supplements to be given to your baby. Don't touch the milk with your hand whenever mixing the supplements. Diaper changes are an essential part of your baby's care. While changing diaper for your baby in NICU, please ensure you follow the following steps. Gather all the necessary supplies, including a clean diaper, cotton, sterile water. Gently lift your baby's legs and slide the soiled diaper out from underneath them. Use a cotton moistened in sterile water wipe to clean your baby's bottom thoroughly. Slide a clean diaper underneath your baby, ensuring it's properly positioned and comfortable. Do not put cord stump within the diaper. Discard diaper in yellow bin. Wash your hands with soap and water after changing the diaper or if you touch stool or urine at any time. If your baby is less than 2.5 kilograms or 37 weeks, kangaroo mother care, or KMC, is a scientifically proven method to reduce infection. Do the KMC for minimum of 8 to 10 hours. Now, let's discuss infection prevention at home, where your baby will spend most of their time. Continue practicing proper hand washing at home, especially before handling your baby, feeding, and after diaper changes. Keep your home environment clean and clutter-free. Limit visitors, especially during the first few weeks, to reduce the risk of exposing your baby to potential infections. Avoid close contact between newborns and individuals who have respiratory symptoms or infections. If mother has cough or cold, she should wear the mask while breastfeeding and should follow routine hand hygiene. Proper eye hygiene is essential for newborns to maintain healthy eyes. If the baby has sticky eye secretions, use sterile cotton dipped in clean water to gently wipe the eyes from the inner corner of the eye, outward toward the outer corner. Use a separate part cotton for each eye. The umbilical cord stump serve as a potential entry point for infections in newborns. After bath, ensure that the umbilical cord stump remains dry. Don't apply anything. Once cord falls off, keep it clean and dry. Continue breastfeeding at home. It is recommended that you exclusively breastfeed until your baby is 6 months old, then breastfeed with solid foods until at least 2 years old. Vaccines are specially designed to stimulate your baby's immune system. By following the recommended schedule, you are taking a proactive step in safeguarding your baby from preventable infections. Thank you for your patient listening. We wish you and your baby all the best as you embark on this beautiful journey of parenthood.